Hello, everyone. I'm Dr. Tosin Odunsi, and I am an OBGYN physician. The first thing I'd like to say is thank you so much for having me. It's an honor to be here. And I want to share my story of how I came from this tiny idea of wanting to be a physician all the way to now as a new attending physician. And I have always wanted to be a physician from the age of 3. But I didn't really know anything about it, but my parents said that I haven't changed my mind. I didn't change my mind throughout my life. So long time doctor to be, or wannabe doctor. And I was very active in high school. I did track and cross country, joined every club under the sun, even Japanese club, and was in some leadership roles as well. But I think I just had a variety of experiences, and I wasn't top of my class. I think I was in the top 15 or 20% of my high school class, and ended up applying to a variety of schools, including Reach schools. So I applied to most of the Ivy League schools, and I did early decision to Cornell University, and then ended up getting in on my birthday in December, whatever year that was. And I definitely was like, oh my God, I got into an Ivy League school. But just to backtrack, because I think it's important for us to talk about imposter syndrome, I wasn't a fully confident person until this last year, actually, in terms of my abilities and whether I deserve to be here. I remember in high school, calculus, probably 10th or 11th grade, where I struggled with calculus. And even though I met with the professor, I still wasn't getting it. It wasn't clicking. So from that point on, I had this imposter syndrome where I didn't think I was smart enough or good enough. And I took that to college, to medical school, and residency as well. So I went to Cornell University, did horribly. And I was like trying hard, didn't do well my first year, and ended up with a 2.7, which I think, and that was after like petitioning to get a grade change. So I think I had a 2.3 and then got one of my grades switched and ended up with a 2.7. And I needed a 2.5 to become an RA, which I ended up doing for 2.5 years at Cornell. But that GPA, it definitely made me think, oh man, I can't get into medical school. And the classes were so big. So intro chemistry was 900 students. So I'm competing with that many people. A lot of people came in with these AP courses, and they were just so smart. And I didn't feel that way for the bulk of my college experience. And then one of the seniors told me, you know what, all you have to do is find the classes that the average is an A, and then take those and make sure that they fall in the prerequisites or courses that count towards your science GPA or courses that count towards your total GPA. So after that first year, I got very strategic with which classes I took. I took upper level science courses and some other random classes. I took design courses just to get my GPA higher. I definitely took human development because social sciences, for some reason, I had an easier time with those, and we are trying to get the GPA up as high as possible. I took Yoruba for a couple of years, and it was a new course, so I already knew or understood the language, so that was great. And it was a beginner course, so that was fine. And took some nutrition courses, took an environmental science course. So all of these helped me get my GPA up to 3.5 by the end of undergrad. And it took 3 years. You can see that it took 3 years to grind it out and really make myself competitive for medical school. Another thing I want to talk about is being discouraged from going into medicine. After that 2.7 semester, my advisor, or maybe the first semester or during the semester, what my pre-med advisor basically said to choose something else, and she didn't really believe that I could do it, but she also didn't give me any alternative path. She was just like, consider something else. And after I left that office meeting that day, I was very discouraged. I called my parents and they basically said, don't mind her. She doesn't know what she's talking about. So I think from an early age, I had that encouragement and support. And I know other people, other colleagues who were discouraged and then gave up. So I'm really thankful for my parents for knowing that I'm already smart. I already have everything within myself, and maybe I'll have to figure out my study style along the way. Another area that I did want to touch on is test anxiety. When I took the MCAT, because of that calculus experience, I thought, okay, I guess I'm just not good at test taking. And it's taken me a long time to say, no, it's not that you're not good at test taking, you just don't know how to get into the mind of the examiner. So I would get very anxious. I would roll into exams like right as they were starting during college because the anxiety was just so much, and I'd have physiologic reactions to that. So going to the bathroom with the IBS and my stomach was hurting, and I'd get headaches and things like that. And that followed me all the way through to step 3 in residency when I was taking exams too. So test anxiety is real. And I'd encourage you, if you do suffer from that, to try and nip it in the bud as early as possible. And I'll go into why later. So I've gotten my GPA. I was pretty active on campus. I ended up taking the MCAT 3 times, twice while I was in college, and only went up a point each of the times and didn't do great. And this was when the MCAT was on the 2-digit scale. And yeah, I was just really upset, like I'm messing up my chances even though my GPA is fine and I'm involved. And again, that imposter syndrome came in. So I ended up taking a year off because I had just gotten married, and doing my MPH, my master's in public health, to take the MCAT one more time. So I ended up taking it, didn't do great again. And I had the whole application done by June, July. And because I wasn't confident, I waited until December, and it took my mom saying, you need to hit submit, all your stuff is done. So I ended up hitting submit, got 2 interviews, one in a school in Michigan and then Meharry Medical College that took me. They both took me actually. So 2 interviews and 2 acceptances. So I look back on my life and I think, what if I had done things with fear and just hit submit 5 or 6 months prior? Maybe I would have had more options, but I also believe that my path is ordained and I'm where I need to be, regardless of what challenges I'm facing. So yeah, if you're scared, make sure to hit submit and do it anyway. That's not downplaying needing to be ready to take exams, but once you've done everything you can do, go ahead and take that leap of faith, and just get it done. Because the worst that happens is that you do it again. And I have seen people who their journey from even finishing medical school to becoming or getting into residency, the longest I've seen is 13 years. So you have to be mentally focused on this goal and nothing's going to deter you. And if you're going to go another path, have a good reason. But it's very easy to get distracted and not remember why you started. Some of the reasons why I wanted to be a physician is because not just helping people, but wanting to be a voice for people who look like me, for Black patients. And I know now that Black patients receive better care from Black physicians. Women also give very good care and have excellent bedside manner. And coming from Meharry, that's something that they taught us. Treat your patients like they're family members. And it doesn't matter if you go to a name brand school or not, you'll get that training. It's about how you interact with the patients. So I ended up going to Meharry, did okay in medical school actually. I was looking at my transcript not too long ago and I was like, oh, actually did fine. But the issue I had is that I had to retake step 1 and step 2, which are the board exams, and you need them to graduate and to apply to residency. So different issues were going on at the time of each of those exams. I missed passing step 1 by 2 points, and then missed passing step 2 CK by 2 points. I passed CS. And then I went on to apply anyway. I was in the middle of interviews and ended up submitting the rank list anyway, and I got my #1 choice of the places that I interviewed. And there is power in networking. There is power of having people speak on your behalf, because I believe if I didn't have that, I wouldn't have matched into obstetrics and gynecology. And then I went on to do residency, and it actually took me an extra year to finish. I took step 3, which is another board exam, 4 times, and the 3rd time I missed passing by a point. And there's this common theme that I have in my life of just like, I'm gonna keep taking these exams until I pass or until I get kicked out of residency, which was a real possibility. And until that door closes, or the window or the chimney or the underground or the attic, I'm gonna take every option. I'm one of those people that has a lot of grit and determination, and that comes from these challenges. And I don't think if you have life easy that you're prepared to handle what comes later. You're gonna have difficult patients. You're gonna have those cases where the patient doesn't make it, especially for my GYN oncology patients who have cancer. They don't all make it. They don't all respond to treatment and surgery. So having that grit, having empathy, having the good bedside manner, and treating patients with respect, all of that lumped together is what makes me the physician that I am today. And while I would have loved to not go through those challenges, I think they make you a very humanistic and not robotic physician. So if you're going through any challenges or issues or troubles, just remember that it's gonna serve you, and you should learn from that experience. So now I finished residency last year, and I'm practicing, and my confidence kicked in actually on my first shift as a new attending physician, where I said, I know my stuff, because things were just coming. And I think from 15 years was the beginning of this journey, and all of that training, all that education. Once you're put on the spot and you need to perform, you know you're a good physician when it just turns on. And because I've been able to battle the anxiety and all those issues, now I have an arsenal of coping skills and tools that I can use to overcome and be a good physician.